Okay, so this is your superior vena cava. It breaks up into your right brachiocephalic trunk, which is going to drain the right upper portion of your body, and your left brachiocephalic trunk. These only show the jugular. They do not differentiate between external and internal jugular. This one, on the outside of the jugular, and the small one, those are both your vertebral arteries. So they're going to drain the head. You could say the same for this one. The jugular drains the head. Subclavian, right about here, and actually I probably should show it here, right before it starts to split axillary. Okay, now I'm going to do superficial first. This is the cephalic vein. Okay, so this is going to drain your lateral portion of your arm. This is going to be here and here. Is the basilic vein, which drains the medial portion of your arm. And then deep you have, this is brachial, which splits into radial and ulnar, and then connecting, and I know they do this weird, basically either one of these, anything that's connecting the two superficial is going to be median cubital vein. It's one of those specifically, but we don't have to know the other one, so one of those. Okay, I turn this around. Okay, this is coming off of the superior vena cava. Okay, so this is the azygos, which continues all the way down here. This one coming off of it is the hemiazygos. Coming off of both of those would be your intercostal veins, which they do not show here. Oh, and I could show this, but I probably wouldn't ask it here. This is going to be your pulmonary arteries. That's the back going to, and you can imagine your lungs would be right there because that's the heart. Those are pulmonary arteries. Okay, so continuing down, the big blue here is your inferior vena cava. Okay, going to the kidneys would be the renal vein. Now, this is the spleen, so that makes, I think that's the 55. This is the renal vein that would drain your spleen. They're not showing it, but you have a gastric vein which would come off of this. 52 is your superior mesenteric vein, so that's going to drain your small intestines, nutrient-rich blood. And then, let's see, that's still that same one. This blue one is your inferior mesenteric vein, which is going to drain your large intestines. So inferior mesenteric, superior mesenteric, splenic all go into, it's hard to see, but this big blue one going up into the liver would be your hepatic portal vein. So I'd probably just use the liver for that, once you get real specific. So inferior vena cava splits into your right, this would be right common iliac. They're not showing a right internal, but they show left internal iliac vein. That's going to drain like your gluteal muscles, your pelvic floor, the bladder. Around here, this is definitely femoral. As soon as the great saphenous comes off, this is femoral. Right here about would be popliteal. This is your anterior tibial vein, which drains the foot, the dorsalis pedis. This would be your fibular vein, which is going to the outside. And then this is your posterior tibial, which you don't have to know, that would drain your calf. This is still the great saphenous. That's going to drain anything in the medial portion of your leg.